This week, CVS drugstores began giving the COVID-19 vaccine at more than 1,000 long-term care facilities throughout Indiana, and that means 140,000 most vulnerable Hoosiers is getting vaccinated against COVID. Joining us now to talk more about the effort and the vaccine is Jason Pribble, Doctor of Pharmacy from CVS Health. Dr. Pribble, Jason, thank you so much for joining us today. Appreciate your time. How are these inoculations going? Are you going actually into the long-term care facilities to give out these vaccinations?
Yes, so far we're 3 days into this. So we started on Monday across the state of Indiana. Kentucky, for example, started a week earlier, and that was dependent on the vaccine that we were actually using, whether it was Pfizer's or Moderna's. But it's been remarkable so far. Just the level of engagement from the patients and residents in these facilities. They're welcoming us in with open arms, and it's just been a remarkable experience so far for our pharmacy technicians and pharmacy teams, pharmacists that are going into the long-term care facilities and providing these vaccinations.
Now, I know you're based in Indianapolis, but this covers, as you said, the state of Indiana and Kentucky. We're here in Evansville. Have you gotten to the southern Indiana facilities yet? And
yes, absolutely. So we had multiple teams down in the greater Evansville area and the tri-state area that started earlier this week. In Indiana, specifically in Evansville, as of Monday, we started with teams going around to local locations there for the vaccination as well.
And have any residents had any kind of issues with? We've heard of some reactions to some folks getting the vaccine. Have you heard of any residents having issues with the vaccine?
Not at all. Everyone that I've been in so far and in my counterparts, it has been extremely well tolerated. And, no, have not come across any type of adverse reactions outside of just, normal soreness, redness that you might get similar to an annual flu shot.
That is really good to hear. Now, just in our last segment on our show, we talked about the Kentucky auditor who tested positive for COVID one day after getting the vaccine. Now, could the vaccine have given him the COVID-19? Or, what's the situation here? How long does it take for that vaccine to really begin protecting someone?
Yeah, so the first question, no, there's no possible way with the way the vaccine is manufactured and constructed that it would give anybody an actual infection of COVID.
It would
All
not.
It's attempting to do is make the body recognize a portion of the vaccine. So if the body ever comes in contact with the vaccine, it's going to recognize it and say, ooh, I know this isn't something that should be here, and work to fight it off. So for the second part, the vaccine is a 2-shot series, and that's both right now for both Pfizer's and Moderna's. We have to return to all the locations that are using Pfizer vaccine in 21 days, Moderna's locations in 28 days to give a second dose. And, when the reports came out a few months ago of a 95% efficacy for the vaccine, that was after that second dose was in. So it is certainly possible that somebody could still, in this interim period between the first dose, second dose, and until a week or two after that second dose, they're not going to have that full protection yet that the vaccine offers. So it certainly is possible for somebody still during those times to come down with a COVID infection. And that's additionally why all of the state agencies, the State Department of Health, the CDC, and all of those are still, reiterating and recommending that even after somebody does have the vaccine, they are still social distancing, wearing face masks, sanitizing, washing hands, and doing all of those things we've come accustomed to over the last 9 to 10 months.
Absolutely. And, I know right now you're in long-term care facilities. Will you eventually offer the vaccine to the public when that available is there?
Yes, absolutely. So we have plans to, once the supply is available, so every state is handling it a little differently as to who the next level of individuals are to get the vaccine. So every state is working down towards those that are most vulnerable, the highest risk populations. It's why we're in healthcare workers and long-term care residents now, and there will be a progression. And as we do get to that public phase, right now we hope that is sometime March and April, we fully expect to have this available in each one of our locations. Right now, it is going to be anticipated to be an appointment only, and certainly as we get closer to that point, we will have more communication out within our communities about how the residents within those are going to be able to come in and get this vaccination.
Well, that is certainly good news. We appreciate you taking the time to talk to us a little bit about this, and good luck with your efforts in getting into the long-term care facilities and taking care of the folks there. We certainly appreciate everything that you're doing. Dr. Jason
Welcome.
Pribble,
thank you for having me today. I appreciate it.
with CVS Health. Thank you, Jason. Appreciate it.